Colombia has demonstrated important leadership in advancing a more balanced and health-centered approach to drug policy, including through multilateral engagement and support for harm reduction and human rights-based responses. And I'm personally honored to be a speaker at the closing ceremony of Harm Reduction Conference in Bogota last year. It's amazing experience and amazing leadership of Colombia. So, Ambassador Tovar, the floor is yours.
Thank you very much for inviting me. Excellencies, distinguished colleagues, ladies and gentlemen, and friends. It is a pleasure for me and for Colombia to participate in this discussion on human rights, the dimensions of harm reduction. I would like first to thank the organizer for creating this important side event to exchange perspectives and on how drug policies can better protect health, but also dignity and rights of individuals and communities. For many years, responses to the world drug problem have relied predominantly on punitive approaches. Experiences shows that such strategies have often produced stigma, marginalizations, and barriers to access to essential services for people who use drugs. As noted by the United Nations Special Rapporteur on the Right of Health, fear of criminalization and discriminalization often discourages individuals for seeking medical care and social support, increasing their vulnerability to infection, diseases, overdose, and other serious health risks. We can also say death. At the same time, the global drug market continues to evolve rapidly, particularly with the emergence of new psychoactive substances and synthetic drugs, which pose complex and fast-moving public health challenges. In this context, harm reduction measures offer a pragmatic, solidary, evidence-based response. By prioritizing access to health and social services, prevention, treatment, and community outreach, these approaches help reduce the health and social harms associated with drug use while upholding fundamental human rights. For Colombia, advancing this discussion also requires recognizing the territorial realities in which drug policies operate. The impacts of drug economy are not evenly distributed. They are deeply felt in specific regions, often rural and historically marginalized territories where communities have faced decades of violence, inclusion, and limited state presence. This reality also demands that we incorporate intersectional perspectives. Women, diverse population, indigenous people, Afro-descendant communities, among others, have been disproportionately affected by the dynamics of the illicit drug economy and by the consequences of drug control policies. Any sustainable response must face this fact. For Colombia, the protection of human rights is the foundation and must be the foundation of any effective drug policy. Approaches detached from human rights are neither sustainable nor legitimate. Colombia has therefore been advancing in a new paradigm in drug policy centered on human dignity, public health, territorial development, and social inclusion. Our national policy strengthens community-based responses, expands early warning system for emerging substances, and support outreach services that bring health and social care directly to vulnerable populations. We believe that open dialogue and international cooperation remain essential to advance more humane, more effective, and more balanced drug policies. Spaces such as this one allows to continue reflecting collectively on how to align our responses with the principles of human rights, public health, and sustainable development. Thank you very much.
Thank you so much, Ambassador Tovar, for these important remarks. And I think for many of us who are not from Colombia, not even from Latin America and Caribbean region, what we saw last year, the level of development of harm reduction programs and drug policy reality in your country was a really good opening in a positive sense. And I think it's something which was to be promoted further. And now it's my pleasure to invite the representative of the government of Finland. The floor is yours.
Thank you, Mr. Chair, Madam Ambassador, speakers, all the colleagues. I was asked just to give a short 3.5-minute intervention on how resolution L6, promoting integrated and coherent systems on scientific evidence-based drug-related public health responses to drug use is going on at the moment. The resolution is tabled by Finland and Norway, our colleague B also here in the room, but since I'm the one Nordic who actually speaks, I'm the one who's giving this presentation. Anyway, we have been, just at the moment, we are in COW, so I unfortunately have to run away here after this brief intervention. We have had informals on the resolution and we have the usual problems, but I must say that the atmosphere has been better than we expected. We do disagree on things, but there's also a lot we agree on. And I think always, as also from our Nordic perspective, we are here to build, not to break. So we really are trying to reach consensus as much as we can and try to, because that we can really agree upon that health dimension is important. Of course, as Ambassador said, it's been like undermined maybe, and it's not maybe as important as some other dimensions, but it's getting more important. And of course, we want to strengthen that. But of course, there are also different views on how we should implement this health perspective. But of course, being in the UN context, we also need to respect that there are different views and different opinions on that. But all in all, I must say that we have known the problems on the beforehand already, but I must say that we are progressing, and there are a lot of things that we also agree. During my CND years, which is a lot, I've seen that the change is slow, but also I'm happy to say that at least some change is also happening. And I think it's also partly of the positive attitude and especially here also these kind of side events and all that we can also kind of support each other to better understand what we mean. Because sometimes it's very often just that we get into our silos and be in the bunkers and don't even want to listen. But of course, in these contexts, we can also listen to each other, try to understand each other, and then, okay, let's see what goes forward this year and how hopeful. Am I too much hopeful? Let's see, that is, but anyway, thanks for all who have been involved, all the delegations for your support. And have a very good side event. I'm heading to COW now. Thank you very much.
Thank you, dear representative of Government of Finland. And now we are moving to our panel of speakers and moving to our first speaker, Catherine Cook, the Acting Executive Director of Harm Reduction International, or CAT, how we usually call her, is a leading expert on global harm reduction policy and advocacy. At HRI, she works on global monitoring, financing analysis, and international policy engagement, among many, many other things. She will provide an overview of the challenging global context for harm reduction and human rights and share updates from the global state of harm reduction and reflect on the current funding landscape. Kat, over to you.
Thank you, Anton, and thanks to all the colleagues on the panel. Thanks, Ambassador. I speak on behalf of Harm Reduction International, and we are part of a global harm reduction movement led by people who use drugs, by communities, by researchers, advocates, and frontline workers. For decades, this movement has been clear that harm reduction is a human right. And when states fail to provide it, that failure is not neutral. It's a violation of human rights. Across the UN system, this is no longer a matter of interpretation or political preference. Harm reduction is now explicitly recognized within international human rights and drug policy frameworks, and that recognition has strengthened significantly in recent years. Here in Vienna, as we all know, the CND took an important step with the resolution 67/4 in 2024, explicitly encouraging states to introduce harm reduction measures as part of their public health responses. This marks a shift. The CND is now acknowledging harm reduction as part of the international drug control framework, not as an optional add-on. In Geneva, the Human Rights Council has moved even further. Since 2023, it has encouraged states to ensure access to harm reduction as an essential element of the right to health and called for urgent action to address the widening HIV funding gap. In 2025, the Council went further still, establishing a clear mandate to address drug policy directly rather than merely contributing to processes elsewhere in the UN system. This is a major evolution. Geneva is no longer commenting from the sidelines. It's asserting its mandate to address the human rights implications of drug policy while providing tools for drug policy bodies to implement human rights-based, evidence-based approaches. Next slide, please. This growing body of resolutions builds on years of work by UN human rights mechanisms, including OHCHR, special procedures, and treaty bodies, which have consistently recommended a broad range of harm reduction services as indispensable to the right to health, including in detention settings. Taken together, these mechanisms form a clear message. Fully funded, broadly accessible harm reduction is not optional, it's a legal obligation. Next slide, please. Despite this strong normative framework, harm reduction remains chronically underfunded. Many programs were already operating on fragile budgets, and recent international funding cuts have forced services to scale back or close entirely. This is not simply a public health failure, it's a failure to fulfill human rights obligations. Under the International Covenant on Economic, Social and Cultural Rights, states must progressively realize the right to health using their maximum available resources. States that can afford it also have a responsibility to provide international assistance for development, and decisions to suspend such support must meet strict criteria of proportionality and non-discrimination. Yet harm reduction is being deprioritized while states spend vast sums on punitive drug control measures that do not reduce drug use and perpetuate human rights violations. Let's be clear, this is a political choice. A choice to fund punishment instead of care, a choice to let programs collapse while preventable infections and preventable deaths rise, a choice that deepens inequality and undermines human rights commitments. The Human Rights Council's call in Resolution 5620 to close the HIV funding gap is not a polite suggestion. It's a warning, and the window for action is closing. Alongside funding cuts, structural barriers continue to undermine access to harm reduction. Punitive drug laws drive over incarceration and fuel a global health crisis. Criminalization pushes people away from services and increases risk. Stigma and discrimination in healthcare settings obstruct access. People in detention are routinely denied harm reduction and basic health services. These are not unfortunate side effects of drug policy. They are violations of international human rights law, and they are entirely avoidable. Next slide, please. So what must happen next? If we are serious about human rights, harm reduction must remain grounded in the right to health, life, dignity, and non-discrimination. As harm reduction is integrated into broader health systems or as new technologies become available, we must ensure accessibility, affordability, and equity. Integration into public healthcare cannot become a pathway to making harm reduction invisible, diluted, or inaccessible. Clear safeguards are needed to prevent that. We must also protect independent, disaggregated data collection, including community-led monitoring, which is essential for accountability and evidence-based policy. And above all, people who use drugs and civil society must be meaningfully involved in all drug policy and health reforms at national, regional, and international levels. Participation is not optional, it's a human rights obligation. So we now have a strong human rights foundation for harm reduction across the UN system. The gap is no longer in norms or evidence, it's in implementation and political will. States must fund harm reduction, remove punitive barriers, and put communities at the centre. And donors must step up, because every cut to harm reduction is a cut to the right to health, the right to life, and the dignity of people who use drugs. The evidence is clear, the law is clear, and the human cost of inaction is indefensible. Thanks, Anton.
Thank you, Kat. We now move to the community perspective, and we are joined by Ahmed Said, my peer, my colleague, my friend from African Network of People Who Use Drugs in person here, and Oleg Dymaretskii, my other peer and friend from Ukraine, from Ukrainian Network of People Who Use Drugs, VOLNa, whose video message will be played later. They will speak about the resilience of drug user-led responses, the realities faced by harm reduction services in the current climate, and the essential role of community leadership in integrating harm reduction into broader system. Ahmed is regional coordinator of African POO, the regional network advocating for the rights of people who use drugs across Africa, with a strong focus on community-led service delivery and policy reform. Ahmed, you have the floor first.
Thank you so much, Chair. And just to expose some bit of conflict of interest, when the Chair is your senior, you have really to be careful how you respond. So congratulations, Chair. And also let me extend my congratulatory remark also to Ambassador Marcela, a well-deserved position, and we bank all our expectation, whether big or small, behind your back, and we are here to support you. I am speaking on behalf of the African Network of People Who Use Drugs, whereby we are based at a regional and also as a leader at the Global South. And across Africa and beyond, people who use drugs have not been waiting for any permission to act. The networks of the people who use drugs are on the front line of the public health response to HIV and viral hepatitis. We are giving out sterile needle and syringes and other harm reduction materials. With the support recently with the United-funded hepatitis C portfolio, drug user-led networks in Egypt, Nigeria, South Africa, Tanzania are in the studying of the low-dead space needle and syringes. And also beyond that, we are also studying about the long-acting depot buprenorphine in low and middle income countries. If you go further in Mozambique, Burundi, Nigeria, Togo, Benin, Cote d'Ivoire, people who use drugs have been demonstrated that they can deliver service and become the most important people in the society. These people actually meet people where they are, be it young people, be it women who use drugs, sex workers who use drugs, men who have sex with men who use drugs, and all the intersectionality across the people who use drugs. This is not just in Africa, but we have also seen the resilience in countries like Australia, where the peer-led model has really worked. But community resilience is not a replaceable for state responsibility. Recent funding cuts and shrinking civil society space force these frontline groups to scale back, to close, with predictable and tragic consequences. Indeed, these are things that are preventable. And if we are not preventing, then we are failing the perspective of human rights. So from the perspective of the community, we there ask for few things, not many. We have a shopping list, but for now, let me present the few. We need fund and sustain harm reduction-led initiative, direct, flexible, and long-term support for peer organization to cover the core cost, because it's the most important, outreach, advocacy, and rapid adaptation. To ensure that there is meaningful participation and remove legal barriers, peer networks must be fully partner in designing implementing, monitoring, and evaluating programs. We need to reform the punitive laws that criminalize service delivery and drive people away from care. Protect the community-led data accountability. Independent data from peer-led organizations are critical for evidence-based policy and resource allocation. Let us invest in community-led harm reduction, which is very pragmatic and principled. It saves lives, it protects the human rights, it strengthens the health system. As African network of people who use drugs, we stand ready to scale up, to be engaged, to partner with governments and all other member states to share the lived experience and lesson from our network. Support what works, back the people on the front line. I thank you.
Thank you, Ahmed, and our heart and support always with African network and with African community for sure. Now we are moving to our next speaker, to Ukraine, but I will represent as Ukrainian and as one of the founding members of Ukrainian network of people who use drugs, VOLNa, along with Oleg Dymaretskii, who is our video speaker today. We mobilized, organized community, and in 2017 established this network. Unfortunately, since 2022, you know that Ukraine is in full-scale invasion from Russia. But despite of all these challenges, since the start of the full-scale war, Ukrainian drug user network has been working on the front line of community response, supporting people with access to harm reduction and treatment, including connection of people who use drugs with long-acting forms of HIV treatment, documenting human rights violations, and operating community support and hotlines to ensure that no one is left alone during this crisis. But unfortunately, war brings specific reality, specific context, and between 2024 and 2026, VOLNa, using community-led monitoring tools, documented more than 1,300 cases related to mobilization procedure, mobilization to army, because and over 750 of these people receiving opioid agonist therapy or living with opioid and dependence. Unfortunately, these people need uninterrupted treatment, but some of the people who want and by health condition can be mobilized as servants, they cannot have continuation of this treatment, and some people who have medical exclusion, they unfortunately, this exclusion criteria is not taken into consideration, and they still mobilized, and unfortunately there are reported unlawful detention, treatment interruption, confiscation of medical documents, denial of care, and stigma. So this is something which community should, this is some new challenge which community should work with and advocating for. But nevertheless, VOLNa is doing great work, and I would like all of us to watch two short videos about how community not only survive, but really do the important work. And it's good to say that over the years of war, Ukraine increased the number of people on opioid agonist therapy patients for additional few thousands of people. So yeah, but it reminds us that even during war, health, dignity, and human rights must remain protected. Let's see the first video.
Україна, 2025 рік. В Україні війна. Люди, які вживають наркотики, хто це, чому саме потрібно приділяти їм увагу, навіщо розподіляти певну допомогу, яка приходить Україні, чому саме не на військовослужбовців або інші верстви населення, чому саме людям, які вживають наркотики, потрібно більше уваги. Хочу наголосити, що з 2022 року по теперішній час спільнота людей, які вживають наркотики, об'єднала лідерів з усієї України. Це 24 регіони і окреме місто Київ. Ми допомагаємо людям, які знаходяться у ключової групи у подоланні питань туберкульозу, ВІЛ-інфекції та СНІДу на Сумщині, Полтавщині, Харківщині, Одещині, Миколаївщині, Запоріжжі, Житомирщині, Кропивницькому, Києві, Івано-Франківську, Львові. Дві організації національні, жінки, які живуть з наркозалежністю, та Всеукраїнське об'єднання людей з наркозалежністю «VOLNa» допомагають вирішувати такі питання, які пов'язані з евакуацією, забезпечення тимчасового житла, надання гуманітарної допомоги, відновлення документів, надання медичних, гігієнічних та харчових наборів для того, щоб зберегти саме людське існування. Насамперед війна повстала у нас такими питаннями, до яких жодна країна в світі, на наше переконання, не була готова. Мова йде про те, що люди, які вживають наркотики, мобілізуються та виконують свої обов'язки в лавах Збройних сил та Національної гвардії України. Наші люди знаходяться в статусі вимушено переміщених осіб з Луганської та Донецьких регіонів, де втрачено майно, де втрачено рідних, близьких, де немає відновлення житла, де немає забезпечення, де немає роботи. Саме ми наголошуємо на тому, що ми є ключовою групою. Ми будемо реагувати на виклики будь-то що. Незважаючи на зменшене фінансування, на заборону певних активностей, на зменшення уваги глобального фонду до ключових груп населення. Ми наголошуємо, що принцип рівний рівному надає змогу забезпечувати соціально значущими потребами саме людей, яких на сьогоднішній день 300 тисяч в Україні. Жодна організація не буде більш мобільною при вирішуванні питання забезпечення доступу до профілактичних програм або замісної підтримуючої терапії в лавах Збройних сил чи при мобілізації. Ми наголошуємо про те, що жінки знаходяться в фокусі уваги, бо це матері, діти, це виклики пов'язані з сумішю, теплими речами та іншими. Тому ми наголошуємо на цьому, ми будемо більш об'єднаними, ми будемо більше спрацювати з органами державної влади та з органами центральної влади. Ми об'єднані, ми сильні, ми українці.
Thank you. Let's maybe watch the second video, but before we start watching it, I would like to remind you that this winter was the heaviest winter for Ukrainians because our power stations and our infrastructure has been heavily hit. Sorry, has been heavily hit by Russian missiles, and people were staying in the houses with 5-10 degrees above zero in the apartment and with no light, but the work is not interrupted. And let's watch how community survives, how community feels at such moments.
Вже багато місяців ворог жорстоко та прицільно б'є по нашій енергетиці.
Світла в наших будинках може не бути по 10, 12 і 15 годин.
А часу цілими днями.
Але попри це ми продовжуємо працювати.
Тому що це важливо.
Наша робота – це врятовані життя.
І тільки це має значення.
Ми роздаємо шприци.
Виходимо на аутріч маршрути.
Ми проводимо ініціативні групи.
Ми адвокатуємо важливі для нашої спільноти речі.
Ми знову і знов говоримо про те, що людей потрібно підтримувати, а не карати.
Ми вимагаємо якнайшвидшого перегляду наказу номер 188.
Бо замість лікування він передбачає ув'язнення.
Україна майбутнього – це країна, де медичний канабіс не загроза для громадського порядку, а ліки.
Де його легальне використання – це шлях до полегшення болю, а не до в'язниці.
Ми досліджуємо нові напрямки, психоделіки та інші речовини для зцілення.
Адже вони допомагають лікувати травми, які нам завдає війна.
Занадто багато травм.
Ми зосереджені на вирішенні того,
що потрібно просто зараз, живучи цієї роботи щодня.
І тоді світло повертається.
І ми розуміємо, що воно нікуди і не зникало.
Наше внутрішнє світло.
І поки ми разом, ми не залишимось в темряві. Слава Україні!
Now we turn to our last but not least speaker, Antons Mozalevskis, who works with World Health Organization on HIV, viral hepatitis, and harm reduction programming, supporting member states in translating global health guidance into national implementation. He will reflect on recent WHO guidance and its implementation at national level. Antons, welcome. The floor is yours.
Thanks, Anton, for introduction, and also thanks for inviting to speak at this session. It was very moving to see the videos from Ukraine. All respect and support to our colleagues there and friends and communities. I will briefly discuss why harm reduction is not only an essential public health service, but also a human rights obligation, and also why it's so important to sustain those services at this moment globally. Next slide. I will start with the current global burden among people who inject drugs. People who inject drugs experience disproportionate burden of infectious diseases globally, as we all know. And 1 in 6 people who inject drugs are also living with HIV, and 4 in 10 are living with hepatitis C virus infection. In some settings, we also see rising HIV incidence among people who use drugs, for example, in countries like Fiji or Papua New Guinea. And in addition, people who use drugs have often higher rates of tuberculosis and latent TB infection, and also not to mention overdose risk and all other health issues. So next slide, please. And these numbers highlight the targeted prevention and health services are essential. So what is harm reduction and what is WHO position? So essentially, harm reduction is a public health and human rights-based approach that aims to reduce the harms associated with drug use without necessarily requiring abstinence. And core interventions include needle and syringe programs, opioid agonist maintenance treatment, naloxone for overdose prevention, HIV and hepatitis services, among other services of the comprehensive package. Harm reduction also proposes to, needs to, and helps to reduce stigma and ensuring enable legal environment. Also, evidence shows that these services are highly cost-effective. They reduce infection and mortality and are essential for achieving the global HIV and hepatitis elimination targets. So WHO position is clear that harm reduction is evidence-based, essential, and should be fully integrated into national health systems. Beyond public health evidence, harm reduction is also fundamentally about human rights. Next slide. Next slide, please. Yeah. So harm reduction directly supports the right to highest attainable standard of health, which is recognized by international human rights law. The right to includes access to evidence-based services for people who use drugs, and states therefore have an obligation to ensure services are available, accessible, and delivered without stigma and discrimination. Governments also should remove legal barriers that prevent people from accessing care and support community participation in service design and delivery. Ultimately, harm reduction protects several human rights, including right to health, right to life, for example, in the case of overdose prevention and management, freedom from discrimination, and also access to scientific progress and evidence-based care. Next slide, please. So speaking about WHO, the global health sector strategies for HIV, viral hepatitis, and STI place a very strong emphasis on prevention and equitable access to services. Harm reduction is recognized as a key intervention to reach the elimination targets, especially for hepatitis C and also HIV. And achieving those targets requires global scaling up of services for key populations. Next slide, please. So this is a busy slide, but basically it is about the targets of the global strategy, which are quite ambitious, but attainable and essential for reaching our target. And they include also specific targets on needle and syringe programs, but also impact targets on reducing the incidence of hepatitis C among people who inject drugs, which of course requires comprehensive harm reduction programs. Next slide. So unfortunately, these efforts now really under big risk, or they face serious financial pressures. As we know, since 2025, after the sudden reduction in global health assistance, many countries have been reporting service disruptions. So this is data from the WHO rapid assessment in the beginning of the financial crisis last year, and shows that 70% of countries were reporting service disruption. Many of those also reporting stockouts of HIV and OMT medicines, which can be really dangerous in case of interruption of OMT services. And modeling shows that if this continues, and that it can cause additional millions of new infections and deaths. Next slide. So to address the requests from member states, WHO developed an operational guidance that helps countries to prioritize interventions, including prevention interventions, and place them into tiers based on urgency and impact. So you see that on one side there are essential interventions which have to be prioritized in all settings in the situation of crisis or humanitarian crisis, including funding cuts or wars and other crisis situations. So harm reduction was placed in the essential tier, recognizing that interruption of OMT carries significant health risks, and these services should be maintained even in constrained financial environments. So harm reduction, therefore, is recognized as a foundational component of effective HIV and hepatitis response. Next slide. So also WHO released some updated operational guidance for both OMT and for needle and syringe programs, including recommendations for maintaining services during emergencies. So these new practical tools are now available online. There was also a launch webinar with presentations from the field, from member states, and from implementing partners that you can reach online. Maybe to conclude, in the last slide, please. So I just wanted to say that, next slide. Just wanted to say that scaling up harm reduction is not only public health, it is also essential to protect life and advance human rights, and also achieving our global HIV and hepatitis targets, among other goals. Thank you.
Thank you, Antons, for this constant and consecutive support of harm reduction from WHO side. It's a pity that your central head office and country offices are facing with a cut of staff, because it was really a good support for us as communities on the country level, especially when the country global fund proposal developing. But I hope we find the way how to continue our collaboration. And now I think we can move to closing remarks. But then I think we will have time maybe for one, maximum 2 questions from the floor. I would like to. It's my honor to invite Professor Michel Kazatchkine from the Global Commission on Drug Policy. Sorry, I was looking. Yeah, Professor Michel Kazatchkine has over 35 years of experience in global health as a leading physician, researcher, administrator, advocate, policymaker, and diplomat. He is currently a senior advisor to the Regional Office of Europe of the World Health Organization and a senior fellow with the Global Health Center of the Graduate Institute for International and Development Studies in Geneva. He is founding member and current steering committee member of the Global Commission on Drug Policy. Professor, the floor is yours.
Thank you, Anton. And thank you for inviting someone from the Global Commission to this important panel. And it's been an honor and pleasure to share the podium with Marcela, Tovar, with Catherine, with Ahmed, Antons. So thank you for inviting me. I just want to make 4 points. The first is that today's discussion clearly reaffirms that harm reduction is not only a public health instrument and a public health in response, but a fundamental human rights measure grounded in decades of evidence. The second is that, as we heard from the speakers, that around the world, harm reduction services operate in very challenging contexts, underfunding, constraints from legal and policy barriers, stigma, cuts to international funding, and war. Antons, I also was very moved, as everyone in the room, I guess, by the testimony from Ukraine. I also see Eli in the audience, and I'm thinking of the work in Lebanon under the bombs. So this means that these are not only operational challenges, but they are a human rights crisis as well. When services are reduced or withdrawn, lives are lost, preventable diseases spread, and trust in health erodes. The third point, and we heard a lot about it, particularly from you, Ahmed, thank you, is that yet communities consistently demonstrate remarkable resilience. Peer networks, community-led organizations, service providers step in where formal systems falter, ensuring people know how to access life-saving services. They are human rights defenders, safeguarding the health and dignity of people who use drugs when governments, institutions, and the entire system fall short. So access to needle and syringe programs, access to OAT, supervised consumption, HIV and hepatitis testing and treatment, overdose prevention is itself an effective remedy against violations of the human right to health. So as you, Antons, and as Catherine have been saying, what does it mean when we say firmly ground harm reduction in human rights? It means ensuring availability and accessibility of services for national programs. It means ensuring meaningful participation of communities, civil society, and service providers. It means addressing legal, social, and economic determinants of health, protecting transparency, monitoring, and accountability, including through community-led oversight, and securing sustainable funding. So in conclusion, what I would like to say is that, to me, this important discussion today is a call. The call is for us all to ensure that human rights are always at the forefront of everything we do. Human rights are universal rights. Human rights are also the rights of people who use drugs. And we cannot win the fight for the dignity and health of people who use drugs. We cannot win the fight against HIV if we do not also win the fight for these rights. Thank you.
We still have 4 more minutes, and I think we can take 1 or 2 comments or questions from the floor. Please raise your hand. But please introduce yourself.
Yeah, thank you so much. Andreina Garin, from the German delegation. I don't have a question. I just wanted to really thank you for organizing this vital event and reminding us and ensuring that, we remember that these conversations that we're having here in this space and also the statistics that we see, the numbers that we see are more than just words or numbers. It's real families and communities as well as real human beings. So thank you so much for this important event.
Thank you. Other questions, comments? Please don't be shy. It's a good opportunity to speak in the friendly environment. Okay, then I think that today's discussion has really reinforced that harm reduction is an essential health and human rights response, and that sustained political will, funding, and community leadership are indispensable to its future. On behalf of Input, HRI, Office of High Commission on Human Rights, and our co-sponsors and partners, thank you everyone for joining us, and we look forward to continue this work together.